here's an anatomical review of the anterior neck region. We'll be basically working in the area delineated by the sternocleidomastoid muscle, the clavicle, and the anterior edge of the upper trapezius. So in order for us to see those structures better, I'm going to mark them on the skin. So here we have sternal notch. If you want to lift your head off the table just for a second, then we can clearly see the sternocleidomastoid muscle. You can go down. So I'm going to do a dotted line for sternocleidomastoid muscle, follow it all the way to the mastoid process. Then the clavicle will be our other landmark. And then shrug your shoulder up towards your ear. Now we can see the anterior border of the upper trapezius. So this is roughly the area where we're going to work on for anterior neck. In terms of bony landmarks, I've already mentioned the sternal notch. Then you can feel the clavicle all the way along to the acromion process. And then up at the top, we're going to start with the mastoid process, which is right behind the ear. And below the mastoid process, if you feel through the soft tissues of the neck, you will feel the transverse processes of the cervical spine, right in this area. Now, remember that the tips of the transverse processes can be quite tender, and we also have vulnerable structures close by. We're going to get to that in a bit. In terms of other soft tissue structures to be aware of when we're working in this area, obviously we know anterior to the SCM we have the carotid artery pulse, really easy to feel. Mid-clavicle, if you put 2 or 3 fingers and sink your fingers in behind the clavicle, you will find the subclavian artery pulse. Now that's an important landmark, so I'll mark it because it will guide us to find the scalene muscle. So I'm going to make an X there. Other vulnerable structures to be aware of, where we have the subclavian artery, we also have the vein and also the brachial plexus. So we want to be aware of that location. And up towards the head, between the mastoid process and the ear, there's that styloid process which can be quite sharp. And also watch for that angle of the mandible, which sometimes can be, again, quite sharp and tender on some patients. Other structures that we need to know of would be the muscles in the area. So that's going to be our focus. So we have the sternocleidomastoid. One more time, lift your head off the table. We typically are very familiar with that sternal head, so that narrower head that goes right to the sternum. But there is also a clavicular head. You can put your head down. And it's a lot wider than we typically expect. So remember that clavicular head, so of the SCM covering 1/3 of the medial clavicle. Now those two heads will join together to insert onto the mastoid process, which we've seen earlier. Now next layer of muscle would be the scalenes. So for that I'm going to use another color. Here we go. For scalenes, the best way to find them is to go back to those transverse processes and know that the transverse processes have an anterior surface, or the anterior tubercles, and also a posterior surface. So you can see my fingers rolling either in front to find those anterior or behind to find those posterior tubercles. So anterior scalene would be starting at the anterior tubercles and sliding down all the way towards the first rib. So roughly I'm going to mark its location with this red line. Now starting at the posterior tubercles, we will have the middle scalene, which will go towards the first rib, slightly more lateral. So now we have middle scalene in the picture. Between the anterior and middle scalene, we'll have that little space where the subclavian artery and the brachial plexus would be located. So important landmark there. And then lastly, we have the posterior scalene. Again, starting on the posterior tubercles, it actually goes slightly more posterior towards the second rib. So its location would be more here. Now, part of the posterior scalene is covered by upper trapezius muscle, so you'll have to sink your finger anterior to the trapezius to find it. Now let's have a look at some of these structures on an anatomical model. So when we're talking about those transverse processes of the cervical spine, you can now see how the tips are U-shaped and actually house the nerve root as it exits from the spinal cord. So we want to make sure that we use either the flat anterior aspect of those tubercles or those posterior tubercles. So we don't want to approach the transverse processes lateral to medial. We want to either be on the posterior aspect or the anterior aspect. Now, a few things to note as we go up the cervical spine. C1 has a significantly wider profile, so the transverse process will stick out quite a bit more laterally. So we want to be aware of that when we're working in this area. Now you can see here that styloid process that's quite sharp. So again, we want to make sure we don't press soft tissue against that, and the closeness of the angle of the mandible to the masseter process. So all of these structures could be tender on some of our patients. We want to be careful with that. And then here you can see the location of the nerve roots, and the brachial plexus will be formed by the combination of those nerve roots.